So hi, everybody. I'm Gila Todou, for those who don't know me. I'm here on behalf, hosting you all on behalf of ICAR Collective. As you know, we are working to try to strengthen coordination. And
Gila, it's really hard to hear you, and I know I'm not the only one, so maybe you can get closer or
I
speak
was
loud.
thinking it was my old age.
Skila's very delicate voice.
Yeah, how is this? Is this better?
Not much.
A bit.
Not much. Oh my God, I just switched mic. I don't know what other mics I could use. 1 second.
Can you increase the volume?
Or closer to the mic.
Is this better?
A bit.
A bit. Tiny bit. A tiny bit.
All right, I'll try that.
Yeah, that's
Ah.
good. Yeah, now we can hear you loud and clear.
Oh.
I'm using my
Now you are
phone's mic.
talking. Now you are talking.
All right, there we go. All right. So I was saying that I'm here hosting you on behalf of ICAR Collective. As you know, we're trying to strengthen coordination, learning, and collaboration across the field in Israel. We spend a lot of our time bringing together researchers, clinicians, educators, policymakers, funders, and every time we ask the same question, right? How can working together really increase the resilience and the speed of recovery of our society that's living through prolonged stress and a lot of uncertainty? And today we decided to really focus on teenagers. It's you look behind and you see that our today's teenagers have spent much of their life and their most formative years with different challenges, right? So they've had COVID. Here in Israel, they've had all the political conflicts and you know, the reform mishpatit, we have the war. Many have been displaced. We have a war within a war within a war, like some people call it the babushka of the wars. You know, we have those security threats that keep getting added on one another. Obviously, that has led to a lot of disruption of the school system. We also hear a lot of social isolation and family stress, which the kids are obviously sponges and they feel all of it. And that, you know, makes them live in a world that's very uncertain. And we have very polarized conversations. Some people say, you know, our teenagers are super resilient. It's so impressive. They're going to be the future politicians. And then others are saying, you know, no, our teenagers are traumatized. And I think those are really maybe the wrong question, because trauma is not one event. It doesn't just happen to someone. It's really a developmental process, especially for children, and it's shaping their identity, their relationships, their ability to learn and regulate their emotion. And our challenge is a bit more complex, right? Many teenagers are functioning. They go to school and participate in activities, and they may appear to be fine. And others are not. They're locked in the room and we could see it. But even those that are functioning, many carry anxiety, loneliness, grief, fear, and we look at them from the outside and we don't realize that they're suffering. We only identify them once they stop going to school, once they have a crisis, once they reach a level. Okay. So we only hear about them once, you know, it's too late. There's actually a new phenomenon for those who don't know that, you know, we're seeing kids get to the ER after a suicide attempt when no one had identified them as at risk because the teachers didn't notice and the parents didn't notice and the friends didn't notice. So what does it mean? Like, how do we notice the signs at this point? So that's the conversation that we hope to have today. I'm not sure everybody will agree with one another, and that's okay, because what we're trying to do is to understand what's happening and how we can help teenagers in the context of this prolonged collective trauma crisis understand, where are some young people thriving and why, where are they struggling and why. And really, for me, one of the most important questions is when those teenagers get lost between resilience and crisis, how do we notice that they need help? So I'm really looking forward to hearing the perspective of all our panelists. And the first speaker we're going to hear from is Vered Winrin. Vered leads the council, the National Council for Children. And last week, you hosted, Vered, I have to say to everybody, with the Yadim Latzafon and Shitufim and a couple of partners, what a beautiful, beautiful event with 150 teenagers from the North that came to speak directly about what they want adults to know about what they're going through. I wrote a blog post about it that I'll put on the chat so that you guys can look at it. But for me, I said to some people, I feel like I learned more from these teenagers than from all of the experts that I spoke to in the last 2 years, because no one can say it better than themselves, really. So Vered, the floor is yours.
Thank you, Gila, and thank you for opening with our event up in the north. And before I start speaking to you, if somebody is bothered by the light blinking, please let me know, and I'll, like Polania, I'll be in the darkness and you'll be in the light. Just let me know, okay? Gila asked me to give you a little bit of an overview through the data we collect, and I have a lot more to say about what children and adolescents say if we have time through the discussion. So I can speak a little bit more about that, but I'll stick to the original plan, and let me just try share screen, and because I want to show you some data that we have collected. Is that fine? Do you see my slides? Everything is in order? Okay. So I'm going to speak to you in my 10 minutes, a huge challenge to speak about the state of children and youth in Israel and trends, challenges, and hope in 10 minutes, but I'll make the best of efforts. So my name is Vered Winrin. I'm the Executive Director of the Israel National Council for the Child. The Israel National Council for the Child is an NGO, and in my 10 minutes, I'd like to say like 2 or 3 sentences about who we are, so you know who speaks to you, and to give you a snapshot on children and youth in Israel and the data we have collected. And then I chose to put a focus, to put an emphasis on the Ministry of Education, and I'll explain in a bit why I made this choice. And then to end through insights for change and hope, and put a little bit of emphasis on youth participation. So when I thought about how to present my organization, my NGO, in just one slide, I thought about this image that, like the pyramids that have been always around. Everybody knows about them and where they are, but the cherry tomato is like the Israeli innovation, and that what allows us to make an impact, like the combination between legacy and innovation. And the legacy part consists of over 160 laws and inquiries and assistance centers that we have that allows us to identify, not only to help individuals, but also to identify gaps and to do advocacy efforts in order to find solutions to those gaps. And we use our knowledge and expertise in everything we do, but also we have innovative models that we create both at the national and international level, and we learn a lot about youth. And one of this innovation model is our youth parliament, that if we have time and during the discussion, I will tell you more about that. But in this area of legacy, the NCC is the National Council for the Child in short, brings its years of experience and expertise to identify problems and offer solutions. And I cannot stress enough the importance of collecting and collating and analyzing and disseminating timely, accurate data about children. The NCC fills this crucial role in the production and dissemination of Children in Israel Annual Yearbook. And what you will see in the upcoming slides are the facts and figures underlying various aspects of a variety of factors affecting the health and well-being of children in Israel. And this reflects the importance that we place on evidence-based, data-driven analysis and holistic approach to assessing the data on children, bringing together a range of sources, forms the basis for innovative solutions, along with an ability to identify trends and measure impact. So if we talk about data during war, so these numbers, it's hard to look at this as numbers because it's human beings. But 69 children were murdered in the October 7 massacre and the wars that followed. And if you look at the number of child casualties of the war, it's almost 1,600 child casualties since October 7th. And I wanted to show you also this data that bears, with no doubt, influence on the emotional and mental health of children in Israel. There was a huge rise in the number of orphan children. And also you can see the numbers of parents of almost 300,000 children serving more than 30 days of reserve duty. And that's something that not always people bear in mind when we speak about emotional state of children in Israel. But if we go into details, the state of the mental and emotional state of Israeli kids, we see a huge rise in anxiety, a huge rise in depression. We didn't see it in the first year of the war, but we do see it since the second year of the war. And also a huge rise in eating disorders in children aged 12 to 17. And
They wore their uniform. They wore a dress. Yeah.
And if we look at the whole group of new mental health diagnoses by the health funds in the second year of the war, we see almost 20% rise among girls and almost more than 30% among boys. And this is an important angle because the gender issue also needs to be something that we need to be aware of. But not only gender issues, but also age issues. And if you look at the rates of suicide attempts by children in general fell in 2024. And I don't believe this will last, but we need to know that the ages 6 to 9 rose by more than 50%. This is alarming. And if you see the numbers of visits of psychiatric emergency departments, you see also there was a very high rise. And we need to bear in mind that the numbers I'm showing you, those are just a formal one. Obviously, children using the private sector or not going to therapy whatsoever because there's a huge waiting line or because they just don't have the energy to do that. We don't see it in the numbers. So the phenomenon is more alarming. But if we look at data on children, even if we're just focusing on mental health and emotional health, we need to see it within the bigger picture. Just see the drug and alcohol use, and these are only ER visits by children. So you see the rise, but you also see a huge rise in missing minors from home. 14% during 2024, but 26% if we compare it to 2023, mostly before the war. And I think we need to be aware also of pupils who dropped out of schools. I was really surprised when I saw this number, like the younger children. This is an alarming rise in children who drop out of school. And this is in the bigger picture. We can see we have data on poverty, which is very worrying, but also a rise in rates of child victims, cases filed open for offenses against the life of minors, like the most severe offenses, sexual offenses, domestic violence. Those are all on the rise. And if you see, for example, the online victimization, Gila mentioned before that a lot of children are isolated and they stay at home, at their room. So online victimization is even more an alarming situation to look at. And the last data slide that I want to show you is about the digital environment. And we know through research, not just in Israel, around the world, that the digital environment and the use of Instagram, etc., according to some research, have effect on emotion and health. And so we need to know that in Israel, the average age of receiving a smartphone is around 6 years old. And that's like the world, the digital world in their palm. So what about the responsibility of the state? And if we look at the responsibility, I would say that it is divided between three major ministries, the Social Affairs, Ministry of Health, but also the Ministry of Education. And I'd like to put an emphasis on that specific ministry. Why? Because all children, almost all children, are at school. And that means that early detection and early intervention is easier done in schools simply because they are there. And so the educational counselors and educational psychiatrists, they potentially can prevent situations and challenges from becoming acute. And we have a huge potential to help children in the school area. So while the need is clear, I hope, and the potential is visible, so let's look in those two slides about the national response. And we did a lot of work. We worked with an economist to create a plan for the state. What should be the desired situation? And if you see that the actual is, just take an example in middle school, maybe I should say a word about in Israel, the system. We have educational counselors at schools, and we have educational psychologists working with schools. And they're crucial for emotional health of children and of pupils. So just look at the slide and see how huge is the gap between the desired, and this is a very minimal desired standards that we put, and the actual. There's no standard hours for a counselor at all at the middle school. And let's see the situation about educational psychologists. See grades, and this is not ages, it's grades, 2 to 12. There is only one psychologist per 1,000 students. And we need, at the minimum, have one per 500 students. So we did a whole work. This is just the result of the work that we did. So this is my last slides, and I want to give you my 2 cents about the insights for change and hope. If we want to change the situation of children in Israel, we need to invest in the workforce working with children and youth. And if I needed to choose just 1 or 2 professionals, that would be those that I mentioned before in schools. Second insight is seeing or treating informal education as a driver of investment and resilience, voice, and meaning. And the third one is embedding participatory processes. We need to learn about children's need and adolescent needs through them, talking to them, having what Gila mentioned, we have a methodology to work with children in participatory processes, but not only to listen to their needs, but also building solutions with children. So just to end my presentation, I chose just one sentence of adolescence that one young girl told us in one of our participatory processes. She said, adolescents face fundamentally different challenges, and it is necessary to listen to them and let them influence the decisions that are made. So with that, I end my presentation. I'll be happy to answer all the questions you may have in the discussion phase. And just saying thank you to ICAR for hosting this webinar and for all your efforts in this, maybe the biggest challenge that Israel is facing right now.
Thank you so much. Those stats are really worrying. I'm blown away by the 6.2 years old average for a smartphone. That seems completely insane. And Murray was just mentioning that we should all read this book in the chat. So funny enough, it's right next to me. The Anxious Generation by Jonathan Haidt. He's actually coming to Israel. I don't know, Vered, if you know.
No, and I've just finished the book.
So someone is bringing him to Israel, and they hope to have enough people to fill Binyanei Hauma. So let's see. And I want now to open the discussion to our three panelists. And we're trying to bring a different, people that bring different perspectives on the crisis that we're facing and different point of views. So the first person I will introduce, the square next to me, is Dr. Hassala Halaj. Hassala is from University of Haifa, senior lecturer, and at the Department of Community Mental Health, which is something that many Israelis are looking into. What is the role of the community? Like, what do we do before it becomes a clinical issue? She's also specialized in mental health in the Arab society and how to think about stigma, access, and cultural adaptation. Thank you for being with us. Sarah Malka Krupnik, Director of Strategic and Project Development at Bet Daniela. Bet Daniela is working with teens that have more severe needs in an outpatient program that helps them fill this gap between hospitalization and return to regular life. It's a very unique model in Israel, especially because we lack these solutions, the in-between transitional solutions. And we have with us Eran Zohar. Eran is the CEO and founder of Basecamp. Hi, Eran. Teens working with teens in the Otef Aza, in the Gaza envelope in the south, as well as with the northern communities, working, with what we call the normative teens, right, in the community, outside of the school setting, to bring more support and belonging in informal spaces. So thanks to each of you for coming and for being with us. I'll start with one question, and would love for you to start by, if there's anything I missed from your introduction that you think is important, but also to start with a question. How do you think teens are communicating their emotional distress today, and where are adults most likely to misread what's happening? So let's start with you, Asala.
Okay.
Hi.
Oh, Sala, or you said Sarah? I don't know which one you said.
Asala.
Oh, okay, sorry.
Hi, everyone. Thanks for having me, and I'm very happy to be part of this discussion. So I'm just going to add to what Gila introduced me, and thanks for the introduction. We lead a project in our department as part of the University of Haifa, where we train community workers and therapists within community, part of it to make the services more within community and now wait for clinic referrals. And related to what Verd said, we also work on adapting tools and early detection in community, adapting to Arabic and Arabic language and culture. As for the question, I think that for Arab teens, I think they are in different stage of development. They forming their identity, they're separating from their parents. In the Arab society, they experience a lot of trauma that often it's experienced as collectively and not individually. So they might not actually they might think that they don't have the right to actually show it or talk about it just because others might be more visible than them or hurt more than them. So I think it can be not in symptoms because a lot of people don't actually know what are the symptoms, the mental health symptoms, but it's more can be in the changing behaviors. They can be more lonely, for example, less friends, less participate in family activities. That's how I see it. But not necessarily like maybe they can sleep less, but they don't talk about it in these words.
Great. Thank you. Sarah?
Okay.
Yeah.
Okay. Now I'm not sure. Asala Sarah. Okay, so just one little adjustment to your description. Beit Daniela actually serves two populations. It started as a response to the lack of continuum of care in Israel from hospitalization to community. There's a huge gap, and a lot of kids fall into this hole. And we're actually named after the daughter of my best friend who died by suicide in that gap. But what we did learn as we developed was that there's another very serious population, and that is the kids, the transparent kids, the kids that fall through the cracks and that are suffering at home. They're self-harm, suicide, getting to the emergency rooms, but not we are interested in preventing hospitalization. So there's a post-hospitalization population and preventative hospitalization. And we provide a program. It's 4 to 6 months that's designed to rehabilitate kids and give them tools to return to the community. And we're a very community-based oriented program. I think that the thing that people don't see, and I think parents especially, is that the kids that are acting out are not acting out as it's not a behavioral issue, and it's just a response to trauma. And I think that there's a lot of work that needs to be done in being able to understand where kids are coming from, what they've been through in these past 6 years, and being able to identify to themselves as well, to give them space for validation so that they don't have to turn to other more maladaptive behaviors and spaces and internet spaces seeking that validation.
Yeah. Thank you, Sarah. Eran?
Hi, first of all, thank you. Basecamp is a few words about Basecamp. Basecamp is an organization that was founded in the beginning of the war in October 23, after we arrived at the Dead Sea and Eilat and met the communities, and we understood that there is a huge crisis with the youth and that the communities need some support with working with the youth. And what we understood is that it's really hard to get to them, to talk to them, to be relevant for them. And we understood that if we will bring informal education methods and we will bring youth counselors to work inside the different communities, they will be able to meet the youth and work with them and create meaningful communication and build the trust with the youth. And actually, that's what we are doing since then, both in the communities of Otef Aza and both along the northern border. We're working with more than 100 youth counselors today that are living in the communities, in the different communities, and meeting the youth every day after the school hours. And I will say, first of all, I totally agree with both of you. I think that the biggest problem that we have is to see the youth and understand what's going on with every one of them. Because the point they are in life, they want to be alone. They want to be separated. And I think that most of the youth, it's really hard for us to know what's going on with them in the communities. And that's the biggest worry. Once they are arriving at the activities, and we have group activity in every community between 3 to 5 times a week, so we know perfectly what's going on with them. And then we see a lot of violence, and we see a lot of frustration, and we are trying to give them the support before they are getting to the red zone, where they will need a bigger support. Our attempt is to support them, all of them, in the communities, in their hometowns or kibbutzim or moshavim, and being there together with them, so they won't need more support.
Yeah, thanks, Eran. I think I think that's a issue that we're all worried about, that many teenagers are in this, I guess, invisible middle. They're actually saying it themselves in some of the research that Vered and has done with Yadim Latzafon, etc. They use the word transparent, right? Nobody sees us. And there's actually a sentence from Winnicott that I really like, where he says, it's a pleasure to be hidden, but it's disaster not to be found, right? Because that's really, like, at the beginning, it could be great. Like, we feel like we can get away with a lot, but when you realize no one finds you, it's so sad. And so this invisible middle, where they're not yet in acute crisis, but they're not okay. What happens to those teens? How do we find them? How do they find us? What could early identification look like if we were, trying to be more proactive? Asala, do you want to start with your view on the community health as well?
Sure. So I think the question is not only how we provide help for these teens in crisis, but also how we actually identify and give them the support they need. Because a lot of them, as everyone said here, they look like they're functioning, but they're not okay. They're carrying a lot. And this can happen from many reasons. Like they still behave the same in the Arab society. For example, there's a lot of problems. For example, the real stigma around mental health. Families might not know what they're seeing, for example, and they're not going to any clinic. And there's also the problem of the shortage of Arabic speaking therapists. And ICAR did a really nice report about that, about the clinics also, in comparison to the Jewish community in Israel. So I think the system is waiting for referral from clinics, but most of the Arab cities, they don't have physical clinics. And I'm not talking even about Arabic speaking therapists. So if there are no services that are adapted and adapted to these teens, so no one will refer them and nothing happen. And I think one of the solutions that we thought about is actually working within the community to with the people who are working every day with these people, so we work with community supporters who are work with these teens after school and in after school programs. But it could be like any other, like just Bert said, it could be teacher, it could be someone they trust. We train these people that they're in a relationship with these teens and they trust them. We give them the skill and the language to understand what they experience and also give them first help. We train them in interventional counseling, which is a shorter intervention It actually was adapted for a crisis events. It's based on the interpersonal therapy. And we train them in this therapy, but we also do early detection where we screen people, see their level of severity of symptoms. Then we know if we want to refer them to these community supporters. And after that, if they're more severe, we can refer them to a therapist. But the goal is to try to identify them before their condition becomes severe, and then it's just it just like it can be worse. So that's what we're trying to do.
Thank you. Eran, you're also trying to see the kids outside of work. Are the members of your teams trained a certain way to spot the children that may be struggling more than others, or how do they do it?
So our mission actually is in every community to try and see all the youth in the community. And what we are doing once we are starting to work with the community is first of all to go and doing kind of a mapping of the youth in the community. So we are taking the list of all the teenagers in the community, and we are starting with trying to collect data about where they are. The big problem was once they came back to the communities, to their hometowns, to the kibbutzim after a long time, especially in the north. We need to remember that many of the communities were evacuated for a really long time in the north, close to 2 years of evacuation. So once they came back, it was really hard to find out who is where and who came back and who didn't come back. So we started with mapping the situation in every community, and then we started with activities in the afternoon to bring all of them. And those who are not coming, we're doing a lot of reaching out. So our counselors are going to knock on the doors on the houses and trying to see what's going on with the youth over there. In the small communities, it's really easier. In most of the moshavim or kibbutzim, you have less than 100 youth in every moshav or kibbutz. So it's a bit easier to understand what's the situation of them over there. And then we try to see who needs more support and who will arrive at the activities that we'll do. And then it is much easier if they are coming, and if not, we need to go and take care of them. And I will say that today we're starting to use more technology in order to see the mapping and understanding how many times every counselor is talking with the youth in the community along the week, who has a communication, who doesn't have a communication. And that's how we're starting to get the bigger picture of what's going on in those communities.
Thank you, Eran. Sarah, anything you would like to add?
Well, yeah, we're not in the same position because by the time people come to us, they are referred. But we have to say, of course, there's been an incredible increase in the referrals, and we have many, many people on the waiting list. So yeah, that's all I have to add.
Yeah, exactly. You see them a bit later, and maybe you can start us up with the next question, which what helps teenagers feel seen, feel safe, feel connected, which is something that happens at all the stages of the pathway, hopefully. And even more in professional settings like yours. So maybe we can learn from that, Sarah.
So I think that the first thing is that with a lot of our teens, they are what you called as, the transparent kids who weren't seen or were bullied. And they live with a very deep sense of loneliness and aloneness. And when they come to Beit Daniela, it's the first time that they've ever been in a framework where they have a peer group that can support them. And I think that makes a huge difference. And I think that, one of our first goals is for the teens to understand themselves what they're going through, and to be able to identify what it is and to identify what it is that can help them. And I think that I think that the ability to both validate them and empower them in that sense makes them, feel that much stronger. I think that would be the key in terms of making them feel safe.
Great, thank you. Asala, you have something to add on how to make them?
I think building a relationship with them, we have learned and seen that at least Arab teens have a trust issue. I mean, it's not a surprise. A lot of Arab citizens have a trust issue with the system. And I think with Arab teens, it's something that we learned that if we build this capacity within the community, again, reaching out to these people who they trust and give them the tools and the language to respond, this will make them share their experience and talk and open up about what their experience instead of keep carrying what they are dealing with. And I think I just want to say one thing about the culturally adaptive services. I think that's one of the things that we're trying to promote within this program, and also as a department, that it's important to provide a culturally adaptive services that it's relevant to the language of the teenagers, to the family of the teenagers, and to their values. And if this and if it's adapted, the family will engage, and if not, I feel like they won't, and they disappear. So I just had to highlight this because a lot of people underestimate how important that the service needs to be culture adapted, and we work really hard to provide this within the Arab society in Israel.
Thank you. Thank you. Iran?
We believe that there are 5 things that we will try to give the youth in the community after school in order to keep them safe. The first one is to make sure that they have a social group in which they feel comfortable. This is, I think, the most important part of it. If they will come out of their rooms or their homes and they will join the group, we know that they will be much safer against what they are dealing with. The second thing is the meaningful adult or the counselor, as we see it. Once they have someone who's taking care of them, who's making sure that they are okay, who is asking them how do they feel every week, it really supports them. We know it has a huge impact. The third thing, is the routine. We are trying to give them some kind of a routine. I will say it was really difficult when they were evacuated, but even today, last week we started the week, and then there was the war of Monday. I don't know if you know it, but on Monday there was a war, and the missiles were here, and then on Tuesday they went back to school. Some of them, those who are in the northern border, didn't go to school. So it's a crazy situation, right? And we are trying to give them a routine, and the routine can be in the community that their counselor is calling them once a week at the same time, or they meet at the same spot at the same time every week. It gives kind of a routine, even if not in the big life. In this thing, it gives them something. So it's an important anchor. The fourth thing is to make sure that each one of them has something they like to do. It can be playing soccer or playing the piano or reading a book. We must find out for each one of them what is giving them the good feeling and helping them get to do it. We found out that it's really important, and it really keeps them in a better way. And the last thing, the fifth thing, is to make sure that each one of them is responsible for something. Once they have a role, they feel like they must do something, okay? It belongs to them. So they feel they have something meaningful because it's theirs, okay? And we believe that once we make sure that each one of them has something like that they are responsible about, it really helps to keep them better.
Gila, we can't hear you. We just lost your sound. Eran, while Gila's finding her sound, when I was in high school in the United States and in youth group, which wasn't quite Sofim, but was a B'nai B'rith youth organization, we had the green jello rule. So whoever was the newest person to join the group had to bring the green jello to the next activity to give the 13 or 14-year-old a task and feel like they were responsible for something. So
That's a great idea. I'm taking it.
I can't agree
green
more.
jello might not work in Israel, but
I can't agree with you more, Eran. I feel that the whole routine and responsibility, especially for kids with mental health, is so vital for keeping them going. And that's why our program is also very much is within life, and I believe in community-oriented activities as opposed to hospital, as opposed to clinic, which enables a kid to meet whatever their challenges are in whatever area they are, whether it's in school, whether it's with their parents, whether it's social issues with their peers. But again, as you say, have the trusted adult with them to guide them to get the skills to deal with each one of those parts of their life, and that allow them to deal with the challenges.
that's right. Can you guys hear me now?
Yeah.
Yeah. All right, excellent. Before I ask another question, I actually want to see if anyone in the audience has any question, either for Salah, Eran, or Vered, or Sarah. Abraham, yeah?
Gila, can I ask a question?
Yeah, Ariela, go for it.
Yeah, okay, sorry. Hi, I'm Ariela. I'm the Director of Development of the Kibbutz Movement Rehabilitation Fund. I actually wanted to ask Eran, because you were talking about the evacuation of the northern kibbutzim. We're putting a very high focus. And we see also a huge increase in drug and alcohol abuse in kids that never had it before. And also in reaction also to what Sarah said as well. I'm just curious because the northern kibbutzim were evacuated. The kibbutzim also are different than the moshavim and then the cities. I just want to clarify that in terms of the way that they work and how they work as a community. If you're seeing a difference between your work in the north and you are in the south, because the north was evacuated to the kibbutzim themselves, which work as a community, were evacuated to over 100 different locations, sometimes one kibbutz. So keeping that community together was work that we were doing also, and we're also working with the teens. As opposed to the kibbutzim and the Otef, which were evacuated as a community. So we're seeing a much higher rate in at-risk situations with the youth in the north. And I'm just curious in how you see that as well. And then also in relation to having that adult that the kids can turn to, one of the things that we're also having a problem with in the north, and I'm assuming everybody is that people are leaving. They're coming, and then the situation is continuing and they're leaving. And so the psychologists and the other mental health professionals and teachers, it's come and go. So the kids aren't having anybody who's someone that they can trust, because as soon as they start trusting them, they leave. Sorry, that's a very complicated two questions together, but
So I just came from, I've been with the community of Be'eri this morning, and earlier this week I was on the northern border. So I'm working with the kibbutzim both in the Otef, and I would say I must tell you something. On the second week of the war, October 23, I arrived at kibbutz Nahal Oz, the community of Nahal Oz. They were evacuated to Mishmar HaEmek, and the first question when I came to talk with the youth, they looked at me, and the first question was, for how long did you come? So like, are you here for a day, 2 days, 3 days? And this was the second week of, after 2 weeks, okay? Only because the volunteers arrived and kept going, and it became a cycle. So our mission is to bring the counselors for at least 1 year. And I must say that the situation right now is that most of our counselors that they are not coming with base camp t-shirt, they are coming with with the shirt of Be'eri or Kfar Aza or Mefalsim or Dafna or which kibbutz they are coming into, and they are working in the kibbutz. And I will say that the most important thing is to bring people who will stay. And it's really difficult, especially in the north, because every time that the missiles are coming back, and in the north, the war until yesterday, the war was still going on. Okay, so it's really hard to keep them in the communities, and we give most of the support as an organization to the counselors, so they will stay and they won't leave. And this is a big and important mission for us. Now, about the difference, there is a huge difference between the kibbutzim in the Otef and the kibbutzim in the north. We definitely see it. Although in the Otef, there was a huge trauma and the beginning was super tough, most of the communities did come back after 3 months, more or less. There are still most of them, some of them later on, only a year later, and 3 of them didn't come back yet. Sorry, we're working with Be'eri, Nir Oz, and Kfar Aza that didn't come back yet. But we definitely see the difference, because once the kibbutzim in the north were getting all over Israel, just like you said, and didn't go as a community. So also coming back and rebuilding the community is much harder. And we say that it is also much harder to bring the youth to the back to the group and back to the activity, because they don't have the trust after they were all separated. So it's really hard, and we're working on it.
Thank you.
Yeah, that really echoes what I heard last week from the kids in the north, right? Some of them were saying, in my class, only 2 people came back, from the beginning of the war. So some of them have really been spread around. Avraham Gerard, you had a question? You have to unmute.
I have many questions because you say to put them in the chat. So
Yeah.
they are in the chat. So I can maybe
You want to prioritize one of them?
well, I will go quickly. I can do it quickly. We are taking in consideration comorbidity, for example, ADHD, very high in Israel, and the accident on the road, ASD, and so on. What is a precondition? What is a comorbidity? Because we see that the children which are more exposed to, for example, suicide, or more at risk, there is a precondition which exists. So that was one element. Do we make the difference between SEL, social education learning, and SER, social emotional resilience? It's 2 different types of education. Have you studied programs that works on resilience education with enhancing impulse control, enrich self-improvement on resilience, and acquire internal locus of control? Those programs with children have shown in very distressed area of America, in inner city, very poor area with drug and violence, a lot of result. So I'm just asking. What resilience after school programs are available, and what is the training of the teacher? So that was the question. Any educational program in Israel, like in US, for violence prevention for educators and students? There is now programs done for that. I wanted to know if we have seen any of those programs apply in Israel. I indicated that I wanted to speak eventually one day to Vered. And are the teacher and kid trained in Dr. Farshi, 6Cs PTSD prevention and first aid program? Because the way we talk to the children, if we talk to them and it become emotional, an emotional conversation, the emotional conversation is in fact totally a conversation which is not cognitive. It's a conversation which is in the limbic system. The limbic system does not think. the limbic system react in flat trees. So we need to engage them in whatever is the situation in a cognitive way, which is done by question, and which is done by asking not only a question, but a question to choose between this and that. When we do that question, they don't enter in PTSD. So we have found on a study that many psychologists are inducing PTSD to their clients, and particularly children. And yes, oh, you don't feel good. Oh, my poor child, tell me how you feel bad. And so on. This is a conversation which leads to a PTSD. There is a way to avoid that. So I was just making a comment. Thank you.
Okay, thank you so much. So why don't we start with the question, Vered, of what is the kind of training program that teachers are getting in Israel? And is there actually a training program that they all get? Because I'm not sure that there is. So Vered, Asala, if one of you have a view on this.
Sala, do you want to start?
I can share what I know, but you probably know better than me. But I know that interpersonal counseling is used as a part of the program. They do train people within schools. I'm not sure if there are teachers, but they are. It's a program that part of the I think the suicide prevention program, which they train people within schools. But I'm not sure if there are teachers. I think teachers is a good idea, but I think it's so complicated getting into the system and train them. But Verd can add more about this.
Yeah.
No, yeah. Well, I'm sure I don't know everything that happens, so I need to say that modestly. But I have a mixed opinion about what the role of teachers should be, because it's not right. I think it's not useful to put all the burden on teachers, and that's why obviously teachers need training, and obviously I think all therapists in Israel, or at least groups of therapists in Israel, should go through training regarding trauma, etc. And that has been done more and more, not enough, but more and more. But and for a reason, I chose to talk about two functions at the school system that school counselors and school psychologists. School psychologists, they work under the municipalities, not under the Ministry of Education, but they work with the Ministry of Education. And they obviously they are trained, but there's so little of them. And if you ask youth if they know their school counselor, a lot of them say, I don't know them. I would like to speak with one of them, but I don't know them. And it's impossible to know them if there's so little of them and responsible for so many children, especially while the needs and stress is getting wider and wider for such a long time. So
yeah, I actually spoke Vered with the NGO that's working on policy shaping for school psychologists. They told me that today the ratio is one school psychologist for 1,000.
Yeah. I showed one slide exactly about that. And we did a whole work because we wanted to do, we put a lot of efforts in advocacy to change this situation. And we also work with children at the area of Beersheba to learn about their needs so we can build with them sort of a policy plan.
That's great. Sarah?
I'd like to add something. Yeah, I can't agree with you more about the need for professionals, but we've actually developed a whole system for training of all of our staff because we believe in community and the power of community. So our staff and our parents and our students all study DBT. And it's an incredibly powerful tool. And we find that we can train the Bnot Shirut and the Embait and the teachers. And when everybody's speaking the same language, even when a child cuts himself and even when they do things that completely freak everybody out in a school system where they'll send them immediately to a psychiatrist, in a lot of ways, a lot of these things could be handled and directed even by ordinary people who are influential in a child's life. So I do think that there needs to be more of that emphasis, of a community emphasis, and less reliance on psychiatrists and psychologists, just because we have such shortages in our country, and we can make some tools more accessible for all.
I'm just going to add one sentence that in Arab society, for example, the stigma is very high. And I hear from teenagers and kids in schools that we know we have counselor, but we don't tell them anything because we don't feel comfortable enough. So I think in cases where teens don't ask for help from these professionals, it is worth training other people in community, as Sarah said.
Yeah, I want to ask, Rabbi Getzelman is on the call and with a few colleagues, and they're actually hosting in the US multiple teenagers that are going to come for camp. Is that right? You want to add something? And maybe we could ask for advice from our panelists on things that is important for you to know.
Great. Oh, thank you, Gila. Hello, everybody. I find this very, very powerful. I'm as a volunteer this summer, I'm going to be a scholar in residence just for a week at Camp Tel Yehuda, which is a young Judea teen camp in upstate New York. And Tel Yehuda is going to have a group of close to 100 Israeli chanichim as part of a mifgash program that the Sochnut is involved with and other players. They'll have about 20 counselors. 36 of the 100 are from Netiv HaAsara. This is the third summer that chanichim from Netiv HaAsara will be at camp. I don't know if probably everybody's familiar with the horrible story of the two teenagers on the beach who were murdered, and their murder was live streamed on their phones, on their Instagram accounts, to the other friends who were in the mamad. These children, by the way, in in the last 2 summers, have never mentioned a word of that to their friends, but we all know that it's there. Anyway, it would be really wonderful to hear as these. I mean, I've already been trying to digest some of this, and I know now that in my teaching and interaction with Israeli kids this summer, the first thing is going to be giving them all the support and that they feel seen, but it'd be great to hear from folks what your sense is about what camp professionals should be doing in these situations where we have these large Israeli mifgash populations this summer. And I'm specifically going to be in a teen camp, but there are younger kids too.
So who would like to, Eran, you want to start?
Yes, we know Netiv HaAsara very well. We are working with them. I have 3 counselors over there. And I think it would be great to have a meeting, maybe a Zoom meeting, before the beginning of the camp, and to talk with their counselors from Netiv HaAsara, with your counselors in the summer camp, and just to try to hear from them how does it look like, and what do they think, because I think the best thing to do is to talk about the routine over here in Israel. I think that one of the most challenging things for youth from the Otef is to getting out of the routine over here. Although it sounds crazy, but for them, the safest place right now is home. And in Netiv HaAsara, most of them came back home. And I think that every time that we get them out of the Otef to summer camps, and we're doing it a lot, so it's a challenge, you know it better than me. And I think that in a way to talk with their counselors and with their staff before would be the best thing.
Well, you
I
should know
guess
that
you do it. And
that through the Sochnut that there are social workers who are with them in Israel and who are coming with them and will be at camp. And they'll be
So there's
working with
continuity.
the care they'll be working together with the care team in the camp as well. So it's which I think is very proud. And the kids, the counselors are all arriving right now. They're at Newark Airport right now getting picked up.
Oh,
okay,
wow.
okay, amazing. So I would just say one more thing that I think the best thing is to treat them as usual, and once they will get open, they will tell their stories
Right.
the way they want to tell it.
Great.
And I think that's the best way to do it.
Right, right.
Thank you.
Great.
Good luck.
Toda.
Yeah. Any other questions or remarks, Sarah or Vered, for David, and any other?
Are there any other Tel Yehuda folks on this call? Did they make it? Anyone here? No? Okay.
No. Other questions from the audience before we close?
Yeah, a question for
Murray.
Eran.
Oh, one
Question.
second. Murray had a question. I'm just giving him a chance. Go for it, Murray.
Well, I just want to thank everybody for the great work they're doing on this important issue. And I think that the diaspora needs to know this issue because Am Yisrael has a big problem, and with the kids are our future. The other thing that strikes me is that maybe to put some of us together to try to map out what innovation technology can do to help. It's not the solution, but it could be part of the help. And because there are some Israeli companies that are coming to the States to sell their products that really could be used in this regard in Israel. Also, here in the States, one of the things that's been effective for this age of teenagers at risk is peer-to-peer education and counseling. It's really been the most effective of all the interventions. So that might be something to consider. Maybe they're already doing it in Israel. But again, thank you all for what you're doing.
Thank you.
Thank you.
Thank you, Gila, for organizing it. Thank you,
Yeah.
Barrett, for moderating it. Thanks for all the panelists that I learned from.
Question for Eran.
Yes, go for it, Alan.
Eran, you said something which we have verified in America with children in very high risk communities. The best results are in the after-school program. But we also have found that the best results are not when the kids are sitting in a room, but when they are standing up and have an activity, because the movement is creating something else. So we made an experimentation to train physical education teacher to become resilience teacher. And we have found that they are the best, better than the school counselor, better than the other people. To teach resilience, we have found because when you do a sport, you learn to push yourself. You need to push your limit. You have also an objective, clear objective. I want to do that today. I was not able to do yesterday. So we have found by the test we have done, and we have a study on that, that the physical education teacher are the best one to teach resilience. So if you are interested, contact me. I have some programs I can refer you, and it works amazingly well. Another way to communicate with the children is not with word, but with icon. So for example, this icon, it's very important. You learn self-helplessness, which is what creates suicide. And you teach the children by icon. So we have a set of icon. And we have done that in school at 6 years old. Amazing results. And we have study proving that the children react better to an icon than word. So if you are interested, I have put my email
Thank
address
you.
here.
Thank you very much.
I think after school program is definitely something to look at.
Yeah,
Thank you so much
I just
for
want
your
to
report.
I want to add one more thing that I didn't mention enough of, what you're saying about obviously kids aren't suited for sitting in a room and talking about their feelings, and they need a very active and holistic program. And what we have found to be incredibly effective is canine assisted therapy. Our dogs are a very central part of our program. We have dogs and horses. But the dogs are really something, and they've just turned around the lives of children. So if you have the combination of the more traditional aspects and regulation skills, and you have the activity of the dogs and the responsibility, shifting the focus from me to taking care of another being it makes all the difference.
Yeah.
And we found it to be incredibly effective.
Pet
Thank
therapy
you
in
so much.
general, not
Yes,
just dogs. Pet therapy.
yeah, pets in general, yes,
Pet
indeed. So I'm going to close us. And by the way, I didn't even ask anyone to ask those questions, but it's a great way for me to tell you that our next webinar is on July 8th, and it's about the importance of movement in a caring, and this one is on July 8th. So we're going to have a few organizations come to talk about surfing and dancing and other ways that is helping folks build resilience. So we hope to see a lot of you then. Meanwhile, have a good rest of the day for our friends in the US. Have a good evening for everyone here in Israel. And thank you all for being with us and caring about this issue as much as we do.
Thank you. Thank you so
Thank you
much.
very much,
Thank
Gila.
you.
Take care.
Bye-bye.
Bye.
Talk to you another day.
Bye.
Bye-bye.